Now, doctors sounding the alarm on two popular weight loss drugs. Doctors say this summer reported seeing some cases of stomach paralysis in patients taking Ozempic and Wegovy. Both drugs saw a spike in popularity this year as weight loss treatments for people without diabetes. Dr. Dawn Belt-Davis is the director of the UW-Madison Comprehensive Diabetes Center. Thank you for your time this afternoon. Can you explain what these drugs are?
Sure. These drugs are both designed to treat diabetes and obesity. They essentially mimic a hormone our body makes anyway and help our body use glucose or sugars more effectively and promote weight loss.
How dangerous is it for people to take these drugs for weight loss?
Well, these drugs are approved for weight loss. So in patients who have the medical indications to use these drugs to help promote weight loss, medically beneficial weight loss, they can be very safe and effective. But we don't recommend patients taking them without a prescription and without the advice of their physician.
And these drugs are also people for type 2 diabetes. What kind of shortages are you seeing right now?
There are some huge shortages that have been affecting us for several months or even years now. Both of these drugs are actually the same drug. They're just different formulations. One, Ozempic, is for diabetes and Wegovy is for weight loss. And yes, patients are not able to get these on a consistent basis. So often they have to stop taking it for a few months. And these shortages are driven by many factors, but at least one of them could be the use of these drugs more for off-label weight loss. They've been very popular in social media, and that's caused a lot of patients to start using them and asking for them when they may not have a clear medical indication.
You said the shortages are causing some people to go without. What does that mean for their health?
Yeah, it can cause them to regain weight if they're using it for weight loss. It can cause their diabetes to be under worse control, which can certainly cause long-term complications and problems. And sometimes they have to switch to other medications in the meantime, which can be challenging and have other side effects as well.
And what would be your professional advice for someone who is taking these drugs or considering taking them?
Well, I think, these again are very effective drugs and they can be very safe when they're prescribed in the right situation. So if a patient is already on this drug or is interested in trying this drug, they should talk to their physician and just be aware that there are some concerns about shortages that can happen and they may need to have a backup plan if they're not able to continue taking it because their pharmacy doesn't have it in stock.
All right, Dr. Davis, thank you so much for your time this afternoon. We appreciate you.
All right, have a good day. Bye-bye.